What are prognostic indicators for pancreatic cancer? Imagine trying to predict the future of a complex puzzle. That's what doctors do when they look at pancreatic cancer. They use certain clues called prognostic indicators to estimate how the disease might progress. These clues help guide treatment decisions and give patients a clearer picture of what to expect. One of the main tools used is the staging system called the TNM system. It looks at three things: how big the tumor is and how far it has spread locally, whether nearby lymph nodes are affected, and if the cancer has spread to other parts of the body. LAR, or tumors or those invading major blood vessels, tend to mean a more advanced stage. If cancer has spread to many lymph nodes or distant organs, the outlook is generally less favorable. This system helps classify the cancer from early stages, where the tumor is small and contained, to later stages where it has spread extensively. Blood tests also provide important clues. A marker called Ca-19-9 is often elevated in pancreatic cancer. Higher levels before or after surgery usually suggest a worse outlook. Another marker, carcinoembryonic antigen, can also help refine prognosis after treatment. These biological markers give insight into the tumor's behavior beyond what imaging shows. The microscopic features of the tumor, known as histopathology, are also key. Tumors that are poorly differentiated or have high grade tend to be more aggressive. If cancer cells invade blood vessels or nerves, it signals a higher chance of recurrence and shorter survival. These features tell us about the tumor's biological nature and help predict how it might behave. Inflammation in the body can influence cancer outcomes. Elevated levels of inflammatory markers like the neutrophil-to-lymphocyte ratio and platelet-to-lymphocyte ratio are linked to poorer survival. These ratios reflected systemic inflammation, which can promote tumor growth and spread. A patient's overall health and ability to perform daily activities, called performance status, also play a vital role. Patients who are healthier and more active tend to have better outcomes. This factor helps doctors decide on treatment options and predict how well a patient might tolerate therapies. The location of the tumor and whether it can be surgically removed are crucial. Tumors confined to the pancreas that do not involve major blood vessels are more likely to be resectable. Surgery offers the best chance for longer survival, so resectability is a strong prognostic factor. Conversely, tumors that are locally advanced or have metastasized usually mean a poorer prognosis. Recently, researchers are combining traditional staging with biological and inflammatory markers to create more accurate prognostic models. These composite systems aim to better predict individual outcomes by integrating multiple factors. All these indicators work together to help doctors classify patients into different risk groups. This classification guides treatment choices, whether surgery, chemotherapy, or supportive care. It also helps in counseling patients about what to expect. Because pancreatic cancer outcomes can vary widely, understanding these prognostic factors is essential for personalized care. Always remember, discussing your specific situation with your healthcare team is the best way to understand your prognosis and plan your treatment.